The Health Professionals Council of South Africa is taking a firm stand against healthcare practitioners that are operating illegally. In June, the council said it had arrested 124 fake doctors from different provinces within a 3-year period. Let's speak to Dr. Magome Masike from the Health Professionals Council of South Africa. Dr. Masike, very good afternoon. What constitutes a fake doctor?
Good afternoon, and thank you for having me. Well, look, the Health Professionals Council is concerned with the increase of bogus practitioners. These are people who continue to operate in our different provinces, masquerading as registered practitioners. It is prudent to mention that it is actually a criminal offence to practice without having registered with the council, as it contravenes specifically Section 17, subsection 1 of the Health Professions Act number 56 of 1974, which says that no person shall be entitled to practice within the Republic if they are not registered with the council. Now, in an effort to eradicate this behavior, the Health Professions Council does the following. We conduct stakeholder engagement in different provinces to create awareness within the public. We have initiated awareness programs through community and national radio relations stations to create awareness, making use of both electronic and print media. We continuously share information through media releases of practitioners who would have been found guilty of operating without registration, and we work very closely with all law enforcement agencies to bring culprits to book. Well, this is in summary what we believe is a bogus practitioner.
So I'll need a little bit more clarity. Bogus
Yes.
practitioner, are these individuals that are qualified medical professionals or qualified doctors that have no license to operate in a particular jurisdiction, or are these individuals that have no medical qualifications at all and are practicing, or is it a combination of both?
Bogus doctors do not have any qualifications. Unregistered is something else. Bogus practitioners are not registered. They have not been to school. They're just chance takers. That's what a bogus doctor is. This is what we find. We don't find the certificate, let alone registration, let alone the university where they were trained. That's what we call a bogus doctor. If found guilty of practicing without having registered with the council, culprits could, upon conviction, be liable to a fine or to imprisonment for a period of not exceeding 12 months, or both fine and imprisonment provided by the Section 39 of the Health Professions Act of South Africa.
Now, you've arrested a total of 124 of these bogus doctors over a 3-year period. Have you arrested them as a result of whistleblowers coming up and saying this individual doesn't appear to be a real doctor? Is it a case where somebody has had a prescription or an operation or procedure that hasn't quite worked out?
It's a multiplicity of issues. Yes, we do get our intelligence from communities. We do get patients who are worried about the way they were treated and the way they were examined. Some of our own colleagues do the same thing. So it's a multiplicity of sources that we are able to get information about bogus doctors.
Now, how do you, as HPCSA, emphasize the importance of safeguarding personal information for registered practitioners? Because I'd imagine the availability of this information is what allows some of these bogus individuals to couch their identities.
Well, when you've got your name as a doctor and you are nowhere in our register, our level of suspicion goes even higher. But we do have investigators who will come and visit your practice, sometimes pretend to be patients and ask a few questions, in the absence of which they are able to get with the law enforcement officers and institute an arrest. We do a lot of intelligence. You must remember, we investigate in order to arrest. We don't arrest in order to investigate. So there's a lot that goes into investigation before an arrest is made.
Dr. Magome Masike, Registrar, Health Professionals Council of South Africa, appreciate your time this afternoon.